I am thrilled to be here, just because what you all are doing in practice, focusing on details, is a spiritual truth of our country.
You know, we can be Democrats and Republicans, but most Americans are patriots.
For over a decade now, good ideas have emanated from the BPC.
Thank you for convening this very impressive group of thought leaders.
Your organization has brought together leaders from across our society to advocate for common sense solutions to our most challenging problems.
Because if it's bipartisan, it's much more likely to pass.
When you have people philosophically and ideologically in two different worlds, and they put them together on a committee, that committee usually is not very productive. Once we get staffs blending, and John and I, they know that the members are friends and we talk, things can happen.
Thank you, Anand, for that introduction, and to the BPC for its important efforts.
Thank the Bipartisan Policy Center. You guys are great.
We all have bipartisan responsibilities to this nation to defend principles that have long made America the beacon of hope.
It's going to take all of us to try to turn down the temperature and really focus on what unites us.
Okay, well, I'd like to welcome everyone to this webinar. For those of you who don't know me, I'm Linda Smith, and I'm the Director of the Early Childhood Initiative here at the Bipartisan Policy Center. First, I want to wish everyone a Happy New Year. This is start of a new year, and hopefully some new changes and new hopes for early childhood in this country. Today's topic, as you've seen, is actually a revisiting of our state-by-state look at state governance. And so we've spent the last year really looking at this, and we're going to talk more about that. Before we get started, I want to thank two of our sponsors, our funders, Heising Simons and the David and Lucille Packard Foundation, for their generous support of this work and their ongoing interest in this issue of governance. Joining me today is Brittany Walsh. She's the Associate Director of the Early Childhood Initiative here at the Bipartisan Policy Center, and she's going to be explaining some of the details of what we did when we did this review. So to the next slide, please. Okay, so the question is why this report? And I want to go back in time and talk a little bit about why we did the first report. And it has impact on this one as well. When we started this, we heard frequently from members of Congress about the overlap, duplication, et cetera, of childcare and other early childhood programs. And so we wanted to take a look at what really was going on, where were the issues. So this report grew out of that. Then we basically wanted to ask some new questions. So you're going to see some of that. So this report, why this report, the highlights of state rankings, some recommendations, and then we're going to follow that with a panel discussion of three people who have been in state administration roles during the last couple of years, and especially the years of COVID and how the management of childcare programs mattered in these states. So that's why we're doing this. I want to go on to the next slide, please. So as I said, there was a lot of concern about the duplication and fragmentation of programs. We thought there were efficiencies to be gained, but not as many as generally Congress thought. There are a lot of times when people would say to us, well, if we were just more efficient, there's enough money to fund this. And we all know that that's not the case, but we couldn't really show that or demonstrate that. So we wanted to dig into that. So we basically looked at the coordination of programs, the functionality of the state advisory councils and where we were with those, data integration. And we're going to spend some time talking about that when we get into the panel, because the data issues are becoming more and more challenging for early childhood. And we learned a lot of lessons, obviously, during COVID. And then we wanted to look at the issues around quality rating improvement systems, and were they inclusive or exclusive of all childcare programs. We took a look at that and determined the progress that has been made, and there's some really good news stories. Brittany will share some of them, and so will I. But we want to point out that even during the challenging times of COVID, we saw a lot of progress across the states in their administration and governance. And finally, then, as I said, we're going to talk a little bit more about the impact of COVID on all of this. So next slide. To set the stage for this, one of the things, and again, this slide points to why this was such a challenge during the last couple of years, and looking at the growth in the childcare dollars and what went out. And that money went out very quickly, had to be moved very quickly, and sometimes with limited staff at the state level to get that work done. So we will have some conversations about that, but we did want to take a look at that. And it just demonstrates the growth in childcare across this country. So now I'm going to turn it over to Brittany, who's going to talk you through the scoring system and sort of the results that we had. Before I do that, I do want to give a shout out to a couple of other staff that here at BPC, Catherine Mercado and Olivia Rotolo, who both worked really hard on this report. This is not easy, coordinating with 50 states and trying to figure out what they have done and have not done in the last couple of years. So a shout out to them, as well as Brittany, who did the lion's share of work on this. So Brittany, I'm going to turn it over to you.
Thank you, Linda. Hello, everyone, and thank you for joining us today. As Linda mentioned, I'm the Associate Director of the Early Childhood Initiative here at BPC, and I was fortunate enough to inherit this project just in time for our update in light of the pandemic. So if we'll go on to the next slide, I'll cover our scoring system. BPC used a scoring system that was developed in 2018 that incorporates several measures of programmatic governance and integration that includes the number of state agencies involved in administrating core ECE programs, whether funding streams were split across these agencies, and the institutional placement of key offices such as the Head Start Collaboration Office. We also considered factors such as the existence of an early childhood state advisory council to provide guidance on ECE issues and efforts to integrate quality metrics, as Linda has mentioned. Finally, our system awarded bonus points if states supplemented federal resources with their own state funding. So for example, to expand Head Start or to provide state-funded pre-kindergarten. And conversely, states lost points in our scoring system if they failed to fully draw down federally provided ECE funding. As in the 2018 report, BPC's analysis is grounded in the theory that the better program alignment and coordination matters to outcomes because it affects how readily families can access services, maximizes ECE benefits by leveraging scarce public resources more efficiently, and promotes better monitoring and oversight to identify service gaps and target continued improvements in program design and delivery. As before, there continues to be considerable variation in states' approaches to organizing ECE programs. As we move along to the next slide, we'll discuss the major findings, which is that overwhelmingly we found states progressed in a positive direction, moving their ECE systems toward a more consolidated structure that increased efficiency and reduced duplication across services for children and families. In total, we found that more than half implemented a more efficient structure or strategy since the 2018 report was issued. Nevertheless, we found that how states consolidated their ECE programming continues to be varied, further lending to our conclusion in our inaugural report that a one-size-fits-all model is not applicable to state governance structures, and that each state continues to have considerable agency in determining how and where to house ECE programming. On the next slide, we'll discuss some of the major trends that we saw. So 3 states, Colorado, New Mexico, and Missouri, have established a state department dedicated to early childhood education. 8 states, Alaska, Colorado, Massachusetts, Minnesota, Missouri, New Mexico, Kentucky, and Wyoming, implemented a consolidated governance structure that decreased the number of agencies responsible for coordinating early childhood programming. 4 states that include Florida, Idaho, Kansas, and Texas implemented an early childhood state advisory council. 11 states, Colorado, Illinois, Maine, New York, North Carolina, Ohio, Oklahoma, Pennsylvania, Vermont, Washington, and Wisconsin now use licensing, health, and safety standards as the foundation of their state's QRIS, ensuring inclusion of all early learning programs in their state quality standards. And finally, nearly half of all states increased the amount of TANF funding transferred to the state's CCDF programming, thus reducing the potential for administrative redundancy. So on the next slide, we have our top 10 states. The two largest denominators impacting the top 10 states' total score was consolidated systems and state contributions to ECE funding. In 8 of the top 10 scoring states, a single agency administered funds from the largest federal programs, including the Child Care Development Fund, the Child and Adult Care Food Program, and the state's pre-K programming. Further, nearly all of these states also house their Head Start collaboration office in the same agency. Whether or not a state supplemented federal funding for ECE programming was the largest factor impacting where within the top 10 these states ranked, with just a few points separating them. Now, as we look at our bottom 10 on the next slide, I want to take a moment to acknowledge that this ranking does not serve as commentary on the work these states have done thus far to continue to create more consolidated and efficient ECE systems. Actually, many of these states have made advancements in their governance structure since 2018. So for example, 3 states that include Kansas, Idaho, and Texas established a state advisory council, which is huge. And Wyoming, for example, consolidated its ECE system by moving its Head Start collaboration office to its State Department of Education, which oversees and administers both IDEA Part B as well as CACFP. Previously, the Head Start collaboration office was housed alone under the state's Department of Workforce Services. But we're not just going to go over the top 10 and the bottom 10. We'll move along to the next slide, and I'm going to pause here and allow everyone time to review it because I understand that the font is small. It's sometimes difficult pulling up the images, but this is where the remainder of the states ranked. The one thing I want to note, in case you can't see it, is that those states that are bolded and italicized, it's representing those whose states' ranking increased since the 2018 report. And I'll hand it back over to Linda after everyone's had a chance to view all of the remainder state rankings.
Wanted to give a special shout out to some states who took some really major steps in terms of what they were able to accomplish even during the COVID time. So the states are on the next chart, please. These states are listed on this chart, and I want to just tell you a little bit about each of these states. Arkansas gained points because they became a state-level early Head Start Child Care partnership, and as you know, we give extra points for that because we think the lessons learned between these two programs has significant impact on what we ultimately do with early childhood in a state. Colorado passed significant legislation that established the Department of Early Childhood and consolidated all early childhood programs under a single agency, which was a major lift in Colorado especially during that time. As Brittany said earlier, Florida established a state advisory council and consolidated early childhood programming. I want to give a shout out to Michigan because Michigan was one of the 4 states in the first report that we did that did not draw down all of its federal dollars. And we actually pinged the 4 states significantly because if you're leaving federal dollars on the table, we just thought that said a lot about governance. And Michigan did draw down all of its money and therefore moved up in the ranks significantly during this time. Minnesota's state government, another shout out, empowered its children's cabinet to function as a single entity, and that group makes all early childhood budgetary and policy decisions now in the state. Missouri, another state that consolidated early childhood programs and co-located IDEA Part B and C. New Mexico, I think most of the country knows that New Mexico has been a star. They continue to be a star and continued their efforts around creating a new cabinet level position in the state. North Dakota jumped quite significantly. We're going to talk about that here in a second. but they consolidated administration of most of their early childhood programming and through establishment of an early childhood section. And finally, Virginia consolidated early childhood programming and are launching their updated QRIS right now, which making participation mandatory for programs receiving public funding. So those are all programs that we wanted to give that special shout out before we go on to recommendations. So let's go to the next slide and we'll talk about our recommendations. They're pretty consistent with the recommendations we made previously. For those states that are considering looking at governance, we have felt pretty strongly and continue to feel this way that we need independent groups to do this, that too often agencies have a vested interest in the outcomes of these, and then it does sort of color what happens in a state. So we strongly recommend to states interested in doing much more consolidation that they look at some kind of an independent review process, that they look at monitoring efforts. And I think we continue to hear across all of our work is that these monitoring efforts are really creating havoc with our childcare programs, and we need to give serious thought to that. In terms of our congressional recommendations, again, the eligibility requirements, it would be so helpful. Some steps were taken during the COVID time to look at this, but Congress can do a lot more to help us on this. So to think about how we bring these programs. We recommend another GAO study to look at this and take a look at what's happened since the last report was done in 2016. Obviously, we feel we made this recommendation before, and we feel pretty strongly that the preschool development grants have produced so much in terms of changes in states' ability to look at data, states' ability to look at their administration, et cetera. So we saw an increase in the preschool development grant funding for this year, and we really urge Congress to continue that funding. Allow governors the flexibility to move IDEA Part B and C together. Right now, as you know, Part B is by law in the Department of Education. And if the rest of the programs are somewhere else, that is a barrier to that happening. And then finally, to use lessons learned from the COVID experience and preschool development grants to identify barriers. And we think this is something that the federal agencies can take on and really do some streamlining themselves and support the states along those lines. So what we're going to do now is move into a discussion of all this with three people that have serious experience with this. And they themselves have all actually had some good news stories out of it. So our panel, turning to our panel, first let me introduce Chris Jones, who's the Executive Director of the Department of Health and Human Services in North Dakota. And as you can see, if you can really read the fine print, North Dakota moved up 12 spots in this assessment from 39 to 27, made a lot of progress in terms of consolidating their licensing, their quality, and their subsidy dollars under a single department, looked and consolidated the collab office and their pre-K program, and looked and consolidated Part B and Part C together. So kudos to what happened in North Dakota and to Chris. Second is Todd Landry, who is let me get the title right, the Director of the Office of Child and Family Services in Maine. Maine moved up 6 spots. And one of the things that they did was to look at their QRIS system and their licensed providers and to build a system where everyone, not just subsidy providers, are in that system. I think in conversations also with Todd, we've had many conversations about the COVID experience, and I look forward to hearing what he has to say about that. And finally, Massachusetts, and this is Samantha Anye-Trewergy. Many of you know her from Massachusetts, where she was the commissioner there during the COVID experience. She's now a fellow here at the Early Childhood Initiative at the Bipartisan Policy Center. So we're going to turn it over and bring them on now and start a conversation about this report. I want to start by having each of them basically tell a little bit more about your experiences in your current role in state government and sort of your just basic reaction to all of this. So let me start first with Chris.
Well, thank you. And thank you for having me. I think I have a unique story to tell, and that I spent the first 20 years of my career doing corporate strategy and business development for healthcare, for a large healthcare system, one of the largest in the country, and was recruited by Governor Burgum when he took office in 2017 to lead then the Department of Human Services. And when I started, childcare was the last thing that I thought I would take any interest in, much less early childhood education. So much to the point that by 2019, I tried to get rid of it actively. I found that it added no value, that it created no joy in my life. And for some reason, it finally clicked. And it's probably the number one reason why I love coming to work each day. And so in my role, right now, I am the Commissioner of the Department of Health and Human Services and have been focused on a number of items, but one of them being quality early childhood experiences. So it's early childhood and education. And can tell a little bit of the story later, Linda, but my background is the entire agency. But as I look at it, being responsible for the largest agency in North Dakota, the largest budget, the most employees, the number one way to reduce the spend in North Dakota in social service programs is high quality childhood experiences from prenatal to 5. So that is the talking point in virtually every budget presentation that I do. So thank you.
And boy, will we start quoting you. Okay, I'm going to move on to Todd. Todd, why don't you respond to that?
Well, thanks so much, Linda, and I appreciate the chance to be with you today. From my background, I currently serve as the Director of the Office of Child and Family Services for the state of Maine. My career has spanned corporate, nonprofit, and government, state government experiences. On the nonprofit side, I'm very privileged to say that the organizations I led on the nonprofit side in 2 different states both had a significant investment in high quality childcare and early learning with accredited centers serving all segments of the community. On the state government side, I previously served as the Director of the Division of Child and Family Services for the state of Nebraska under Governor Dave Heineman, and about 4 years ago had the opportunity to come to Maine and was pleased to be able to join Governor Mills' administration in leading the Office of Child and Family Services. Our office has responsibility for child welfare, child care, children's behavioral health services, and children's licensing and investigation services. And one of the things that similar to Chris in his, I would say, relatively newer founded understanding of the importance of high quality early learning. I truly believe that if we get early and high quality childcare and early child development right, it is going to drive tremendous benefits down the entire spectrum, including in the work that we do here in OCFS in Maine with child welfare, children's behavioral health, but it'll also extend through that entire lifetime. If we get this right, we're going to be earning dividends for many, many years to come.
Okay. Boy, both of you guys are going to be quoted significantly. Let me just tell you that. So, Sam, where is Samantha? And Samantha, why don't you tell us a little bit about yourself?
Absolutely. Thank you. And I think that this is such an important topic. So excited to be here. I most recently, as Linda mentioned, was the commissioner for the Department of Early Education and Care in Massachusetts, which is one of the first consolidated governance models in the country. Prior to that, though, I was actually the chief of early learning in the city of Chicago in Illinois, which experiencing a non-consolidated governance model from the community level, and came to that, I think, like Chris and Todd said, I came in a very different way through teaching and came to the the policy level and the governance function through having been a teacher on the ground. And so I think that part of one of the things that I came to as commissioner during COVID is keeping in mind the difficult challenges that it is to negotiate different state departments when you're trying to, as Chris and Todd said, do some of the most impactful work we can do for children. And so really taking, I think my experience during COVID in Massachusetts was the opportunity to use that consolidated governance strategy to try to make it as easy as possible for the people on the ground to do this work. And I think that governance is such an important, meaningful strategy to try to do that so we can get those impacts that Todd and Chris were talking about that can be really transformative, not only to children, but as they pointed out, to other state funded services that are needed later on.
The first thing I want each of you to address, and Sam, will start with you and go the other way around this time, is this: the three of you were in your jobs during COVID when it all hit, what happened and how you saw your way through that. I'd really like for you to tell us a little bit more of your experience in the state, what worked about your systems, what didn't work, what you would suggest to us as we move forward with this kind of effort to look at the governance and the structures. So Sam, why don't we start with you this time?
Absolutely. So one of the things, and I've had the luxury in the role as a fellow at BPC of trying to learn to compare some of my experiences in Massachusetts to other states as well. One of the things I think that really worked in Massachusetts of having a consolidated governance for early childhood, but also under a secretariat that was a sort of an aggregated governance model that included elementary and secondary education and higher education, was the ability to try to be a united voice as many different things were being negotiated at the leadership level, to try to have one voice that was advocating for the totality of education, both the similarities and the differences, trying to leverage some of the resources that may be put into one of those departments for the other two. I think their structures are similar and different in such meaningful ways across those three sectors of the education field, that having one unified look was really a benefit through COVID, particularly when you were grappling with the needs of health and human services, for example, across the education, things like PPE, things like regulations around what kind of masking requirements or things along those lines were all really important to be able to try to leverage resources across the education field. I think one of the challenges, of course, is that during something like a health crisis, the health and human service data was so important that coordinating across health and human services and education became a really critical challenge to try to solve. And again, having a consolidated education lens made it a much more unified, easier challenge to try to solve than trying to do it individually in three separate education departments.
Okay. Todd, let's go to you next. And if you can, I would really like for you to talk a little bit about the mental health work that you all did and how that worked in Maine with your structure.
Yeah, well, thank you very much, Linda. I think I'll point out to a couple of pieces. I'll start where you alluded to there, some of the mental health components of the work that we've been doing here. I think one of the big advantages to having OCFS as part of the larger Department of Health and Human Services within the state of Maine is we did have some great access to two really critical pieces during the pandemic. The first being our sister office with Maine CDC, which of course was leading the effort from the public health perspective around COVID and the COVID response. Having that close connection really enabled us to have immediate access to the latest information, learnings, and guidance that we then in turn could then expand and spread out to our communities, our providers, our families, et cetera. But the mental and behavioral health aspect of this was also absolutely critical. We know that there were significant stressors going on to families, to children, to youth, and some of those certainly have continued as we have experienced our recovery from the deepest aspects of COVID. But through our adult behavioral health side, another one of our sister offices in DHHS, we were able to use their Strengthen Me and some of their options programs that they were able to launch to help adults, which was absolutely critical in this. And then we, within our department, we were implementing our early childhood consultation project for infant early mental health consultation. And that proved to be a great source of strength during this time period as well. And having learned from that, we're now expanding that to a full statewide program beginning this year. So looking at that from not just the physical health aspect, which was obviously very vital during that time period, but the mental and behavioral aspect of that was critical as well. The one other piece that I would like to just briefly mention is in 2019, when I started in this role here in Maine, and when none of us had even heard, I'm pretty sure, of the topic of COVID or coronavirus, one of the things we still recognize, I think it was one of the best things that helped us out during the pandemic as well as ongoing, is what we made the decision as a state to move our children's licensing into the Office of Child and Family Services, which meant that we had the opportunity to completely align our children's licensing and our subsidy program with our QRIS systems, et cetera. That was so important during the pandemic because we were able to leverage the licensing aspect along with our subsidy program pieces, make sure that those were completely aligned to support our children, our families, the workforce, as well as our providers, to ensure that we were meeting all of those needs and taking advantage of that efficiency of having both of those units in one office. I think that was one of the big factors to the success that we had. And you combine that with the other piece that I talked about was absolutely vital, I think, to us responding the way we did, and for Maine, in my opinion. And I think the data supports it, being one of the leaders in our COVID response in the country.
Okay, Chris, how about you?
Yes, so most of our changes happened in the last legislative session. So all of our governance changes, everything happened really after COVID. And really in North Dakota, compared to the other two states, we were quite open as it relates to COVID restrictions and the impact it had. And obviously there's pros and cons with that. But the thing that I noticed as we went through COVID, it was the things that aren't even in governance. It was how you develop relationships with sister agencies and outside organizations. And again, I would not be talking to you all today if I didn't have a great working relationship with the Department of Public Instruction, and really, walking arm in arm, or as she would say, I'll play Robin to his Batman as it relates to early childhood, and then vice versa. I'm Robin to her Batman as it relates to health and human services for K-12, and really being focused on what each other's roles and getting out of each other's way. I know that we've met with other states, and they find it quite odd that state agencies would work together. And I think that was one huge benefit. We didn't have any systems. I mean, our licensing was one place, our QRIS was another, our Department of Health and Regulations was in another. So all of those things just didn't exist. And the other thing I would say is, I believe that COVID didn't help us raise awareness in North Dakota for the need for better systems for kids, just based on where we were. I felt like it put us a couple years back, and now we're trying to regain that. There's some pros and cons to that, but I think it's how each state approached the impact to children and families as it relates to early childhood, where their ideology existed. So I'd leave it there.
Todd, you wanted to add something to that?
Yeah, I absolutely agree with Chris on the topic of those relationships and how important those relationships are. You know, I know in the report, certainly it's advocated to have as many of these programs in one bureaucracy or agency versus multiple ones. But whether it's 1, 2, 3, 4, relationships are still how we're going to be able to get much of our work done. And to the credit of Governor Mills, one of the first things that she did in 2019 in her first term was she started the Children's Cabinet in the state of Maine, something that had been dormant for the previous 8 years. And I don't think we realized how important it was, because the Children's Cabinet, of course, includes the Department of Health and Human Services, including our office, but also the Department of Education, Department of Labor, Department of Public Safety, and the Department of Corrections. It fostered those relationships so that when we did hit just a year later with COVID and the pandemic, it was really those relationships I think made such a difference, so that we were aligned to the greatest extent possible with our Department of Education on guidance, so that the school guidance was hopefully as aligned as possible to the child care guidance, because otherwise all we're doing is confusing our parents, we're confusing our schools, we're confusing our child care providers, we're confusing everyone. Those relationships, I think, made such a huge difference. And to Chris's point, I think he's 100% right. Yes, we need good policies. Yes, we need good structures. Yes, we need good, all of those pieces. Those are essential. But at the end of the day, it's relationships that really drive these things forward.
One of the things that I think is often overlooked, and I think, Chris, you brought it up, is this issue of licensing. And I think when you talk about mixed signals to childcare providers, so often they come around licensing and interpretation of regulations and some of those things. And I do think that aligning those things, if states can do one thing, they really need to look at that and need to look at the enforcement of any regulations, whether it's CACFP or childcare, health, or whatever it is. I think those things get in the way. I want to push a couple of you, because you kind of said what did work, but what were the challenges or what didn't work? And Chris, how would you answer that?
Well, that would be just a really long we had to comments made earlier. One, we had no data. Two, we didn't know how bad the gaps were. Obviously, child welfare, not obviously, but within the Department of Health and Human Services in North Dakota, child welfare is within there. I mean, initially, we were really concerned about our ability to really have a line. It's an extra line of sight into the safety of kids and their families. And I think we missed some things. Well, I know we did. And so thinking of it more of as a system, I guess early childhood experiences are just more than, childcare. And it's so thinking of it that way, we didn't have an aligned system in any way, shape, or form. And we didn't have an aligned ideology I know this is being recorded. I'm thinking through whether I should say what I'm going to say, but I think this is for any state. So I'll put it this way. The decision to close schools, K-12, was like, oh yes, it's for the safety of the children. And oh, by the way, the teachers. That was consistent in all 50 states. Mm-hmm. It was not consistent in early childhood. And it was really at that moment that it became clear to me that this isn't, in a lot of states, in some form or fashion, is an afterthought. Mm-hmm. And in some ways, unfortunately, I think it still is. It's getting better. But, I don't remember who said it. You don't have to recover from a good start. If we would just think about that in prenatal to 5, it's just that's what didn't work. It was all about schools. It was all about nursing homes. It was all about hospitals. And it wasn't about how are we interacting with our truly most vulnerable. And that was very frustrating for me. And I think those who know, which isn't the majority, going forward. So I know we worry about learning loss, but we're not talking about the impact on 0 to 5. So, I I don't know if I answered your question, Linda, but that's what really didn't work. And it's still, we're not there yet.
And thank you for that, because Chris, I think one of the things that I've said since watching all of this, and I think there's always a negative and a positive to any situation. The positive to come out of what you just described is this country got it finally, that how different these systems are too. I mean, I keep saying to people that, when the guidance came out and closed down the education system, closed down childcare was that if there was ever a time when childcare was threatened, it was then, because no income, lights out, no rent money, no nothing. The teachers in schools got paid, the childcare teachers got nothing, and I think the country woke up to what exactly we have for a childcare system during those weeks and months where that happened. So if there's a positive to come out of a negative, I think that was it. But I'm really glad you put that on the table because it was important. Todd, what about you on that one?
Yeah, I agree with Chris. I think we learned a lot about where some of our gaps and where some of our challenges were. They were there before to a large degree. What the pandemic did was it really highlighted them and really pointed out some of those pieces. And it generated and has generated and continued to push forward some of the discussion points I don't know were as prevalent, perhaps not, almost not existent, around the importance of childcare, around the importance of early education, around all those pieces that my colleague Chris just talked about. It's not just about the care aspect. It's not even just about the education aspect. It's about those other related pieces that provide those strong protective factors for the children and their families that they can last, for many years and an entire lifetime. In Maine, I would say one of the big things that we saw was we had some really, really good data on our subsidy program and what was happening there with the subsidy program and numbers. We had some really, really good data because we had integrated our licensing program into our office. So we had great data on licensing and capacity for licensing, et cetera. But what we didn't have really good data on is attendance. And that is something that we still struggle with. We have good data, like I said, on capacity. We have really pretty good data on enrollment. Attendance is something that we don't necessarily have great data on. And so it highlighted some of those pieces where I think we did have some data gaps. It also, of course, shone a wonderful bright light on where we could take advantage where we had good data. But I think the data component was one of the pieces that I think in all of our states, as I talk to my counterparts across the country, we all have strengths and areas of improvement with our data. But I do think that data and the importance of it really came to light from an efficiency perspective of governance.
Mm-hmm. Well, I have you, and I need to note to the audience that we are going to, in about just a few minutes, take questions from people across the country. We already have one, Todd, for you, so I'm going to go ahead and insert it because it adds on to what you were just saying. The question is, did the relationship to unite to ask children's licensing to be moved over to the child care department, or was the legislation passed, or was licensing moved through administrative authority? In other words, how did you do that and why?
Yeah, it was through administrative authority. And so it was within the Department of Health and Human Services. So because it was already in the Department of Health and Human Services, it was an administrative move from a different division into the Office of Child and Family Services. And one of the real driving factors on that was, I believe, a recognition that the issues and impacts related specifically to children's programs, whether it be childcare, whether it be children's residential facilities or similar programs, the issues and the topics that you need to deal with and focus on from a licensing perspective are quite different versus, say, adult nursing homes or adult assisted living facilities or some of the adult programs. I'm not saying either one is more or less important. They're both important, of course. But what you need to look at and the pieces that are embedded in that from a quality perspective are quite different. And so that was a big piece of the driving factor. The other piece was to tie it into our quality rating system. And I think that's one of the things that you emphasized in the report. It's one of the things that we have found here as well, is when you have that good alignment with your quality rating system along with your licensing, it makes things much smoother, easier, and quicker to implement some of those changes. And I believe, as a former provider, I believe it also makes it so much easier from the provider perspective that you don't have QRIS saying one thing and licensing saying another. That alignment is absolutely critical to help our providers be as efficient as possible. And that hopefully drives better outcomes for all of our kids and families as well.
Sam, your response to that.
Yeah, well, I will start by echoing my colleagues here that data gaps, and just go a little bit deeper into that and where some of the infrastructure existed and didn't in Massachusetts around that. To Chris's point, Massachusetts was one of the states that did close childcare. We created an emergency childcare program, which at the time I thought was going to be the hardest thing we had ever done. And I was wrong, because reopening childcare was definitively the hardest thing for all of the reasons that Linda said, that I don't think we recognized going into that crisis. All of the systems that were lacking to be able to sustain it during a closure and then reopen it or rebuild them in order to reopen it. So data was a critical component of that. Like Todd had referenced, Massachusetts is one of the places that does have the QRIS, the CCAP, the Child Care Assistance Program, or the CCDF funding, as well as QRIS out of a single agency. Even then, the data systems, while managed by a single agency, weren't built to talk to each other very well. And so it was a lot of manual hours of literally decoding Excel sheets that you could pull off the database, but didn't necessarily give you the kind of information that was actionable in and of itself without looking at, for example, only 20% of our utilization of our licensed capacity prior to COVID was funded through the child care assistance funding, so the CCDF funding. That becomes a really big gap when you've closed down a system, and 80% of the funds that had been going into the program, and probably even higher amount of funding, we don't know what happened to it or how to restart it or who was enrolled. And so, even to get to the idea that there was only 20% of the capacity was number of hours to try to detangle different databases to calculate that. And that kind of information coming out of COVID and to Linda's point of really being actionable in terms of ways that you can sustain this critical industry was a huge gap, and something that really needed to be, that really took a lot of hours to try to overcome. The one other thing I would love to just highlight, I think, from Linda, you mentioned it after the last question, but I think it's really relevant here in terms of my experience in Massachusetts, is regulations. The regulations in Massachusetts were so outdated that in order to be able to keep up with the health requirements and keep up with the families' requirements of what they needed, as for example, schools closed. And then families who had to go to work didn't have any option but to leave their children alone. So we had to coordinate with childcare. The regulations were so limiting that during the crisis, rather than be able to work within our regulations to be able to support programs, the governor ended up having to suspend many regulations altogether to allow us to quickly be able to create new systems. And I think that that's something that we didn't pay enough attention to prior to COVID. And I think just highlighting, Linda, your point of that being a real challenge when you're trying to think industry-wide or sector-wide, and really keep families at the center of that, and not requirements and compliance becomes a real challenge when you don't have things that are updated for the modern economy and the modern landscape and the modern investments that have been made by other agencies.
I hear a lot, and as I, talk to people around the country, and I think we really do have to deal with the regulation issue, because a lot of regulations have been layered on and layered on and layered on. And I think there's a fear within the early childhood community and the advocacy community that if anybody suggests that we open regulations, it's a negative. And I do think we're going to have to start to deal with how do we really take a look at these and get rid of some of what is holding people back. I mean, there really are. There are cases to be made for that, even though sometimes that's not very popular. What do you guys think is the biggest challenge to the states that haven't been able to do anything along the lines of consolidation or looking at this? What advice would you give them before we move to another question? Anybody have any thoughts on that? Because we have a number of states that really do. I mean, as you saw in the report, a lot of states made progress, but we have a long ways to go. And, I think sometimes it's overwhelming. How do you start? What advice do you give people? Sam, why don't we just start with you?
Yeah, I mean, I think this is fascinating to have these three states represented here, for example, because they're such different models in terms of how I've gone about it. So I think that would be one of the very first things that I would ask a state that was considering some of this is, what's your North Star? In Massachusetts, public education is such a driving force of every legislative conversation, and very proud of being the birthplace of public education, that aligning the early ed system around a public education model made a lot of sense at the time that it was done, and continues to be a driving force. But I think for other states that have made a really compelling case around governance aligned with human services, looking at your North Star as a state with your executive leadership and understanding the path that makes most sense, keeping in mind that the experience of the family and those serving the family, not the state agencies and how it's currently configured, I think is a place to start. I think it's the culminating thought is I think it's very, very difficult for a state to go in and replicate another state's model without doing some serious analysis and self-reflection of why that model really makes sense for the way their other systems are set up. The other one piece of advice I would give is keep the North Star, but remember incremental components. Don't make the perfect the enemy of the good, because that North Star should drive the work, but shouldn't prevent you from moving forward at all.
That's a good point, Sam. And that's one of the things we tried to do in the report was acknowledge, and I think Brittany said it really well, even within the bottom 10, there was progress, and we have to acknowledge that, because some of that comes, not easily. So Chris, what would you say on this?
Well, one, I think Sam did an excellent job. I do think just in my experience and being part of this, because again, I knew nothing about early childhood at all, and I didn't want anything to do with it. I thought it had no value. And I would, just to give a shout out to the bipartisan policy and the work that you provide to us, as well as Hunt Keen and all these other groups are trying to figure it out. But talking to other states, there's been people fighting for this for 30 years. And they're exhausted too, and want to call them out. But then at the same time, I would say for those, they need to be part of driving it, but they also have to have an open mind to really what Sam said. Don't let perfect be the enemy of good. Look at the approach. Who are your stakeholders? Do you approach this from a workforce strategy or from an economic development? Do you approach it from brain development? Do you approach it from, it's just such a win-win-win, and everybody who's probably on here already knows that. But it's really knowing, okay, this is this legislator, that's what's important to them. So, and be willing to engage and have the conflict. This is them, be willing to engage and have the conflict. Yeah. And even one of the things I said that I got in trouble for, and I know it's being recorded. I've done this before, if you haven't figured this out, but I was on a conservative radio show. And on that show, they said, Chris, it sounds like you're advocating for universal free childcare. I said, nope, that's not what I'm saying. However, what I am saying is, if you're saying that women should stay home, then I'm saying I do not want my tax dollars spent for scholarships in higher ed for women, because you want them to stay home. That's a waste of my money. And so, I mean, so you want to engage with folks and challenge their previous assumptions from where they're standing.
Mhm.
And I think so, you just got to be blunt and go right at them.
Good advice. Okay, Todd.
I'm not quite sure how to follow up on that from Chris, to be honest. So I would say just this much from this perspective. I think one of the things that I absolutely love about the way that these programs are structured is each state does have the ability to decide what is the right structure for them. When I was in my doctoral program, I think the one thing I learned more than anything else was context matters. And context matters certainly in this arena. And so your own individual state context should drive these discussions. A report like this from BPC gives you a lot of things to think about. And I think it's invaluable to be able to compare, contrast, and learn from what other states are doing. But you still have to do it from the lens of your unique state. What worked in our state in Texas, what worked when I lived in Nebraska, those are different from when I now live, where I now live here in Maine. And so that context matters. So recognize that a report like this is a great jumping off point for discussions that you may want to have in the state. But recognize every state's going to devise their own system that works for that state. So yes, we should be learning from each other through reports like this. And we should also make sure that we're looking at it from the unique lens of our own situations and contexts.
And thanks for that, Todd, because one of the last things I want to pose to all of you, I say whenever I get asked this question, when people ask about this report, and they sort of take what we say as a recommendation. And we are not making recommendations for how states structure this, but we are saying that they need to think about these things. And that there's no right way to do this. I mean, when it comes down to it. So there's no one model that works. And I think you've all said the same thing. But there are things, no matter where you are putting this, that need to be thought about. And I think that's what our message has been. So I guess the last thing I want to ask you, and Todd, you kind of said it. If you were in our shoes at BPC, what would you do with this report? Is this report worth it to you all? What could we do to make it more useful to people? Because we'll take a pause here, but probably in a couple of years, we'll be trying to think this thing through again. So starting back with you, Todd, I think you kind of touched on that.
Yeah, I think I did. I would say I think it's a really great, useful report as a jumping off point for lots of states. I think it's always a challenge, I think, for any state whenever you do a state ranking, because by definition, some states are going to be ranked higher, some states are going to be ranked lower, and so I think it's always a bit of a challenge because you don't want to put anyone, any state in a defensive posture. When I think the intent of a report like this to be able to compare and contrast different structures as an informational sharing piece of it. Now, we happen to be here in Maine, one of your top 10 ranked states, so we feel really good about it, right? But I think that's just something to think about. But I think the ranking itself, will get people interested in the report, so that's a positive. But I think a webinar that follows up a report like this, like we're doing today, is really important to understand. The end all be all is to not replace DC as the number one on this list. The end all be all is not to cast aspersions, of course, upon those that may be ranked lower, but it is really to drive the conversation of what we all want and agree upon is efficient and effective systems, and recognizing that there's lots of different ways, as your report shows, to do that. But let's drive the conversation about, is our system as efficient and effective as we want it to be? And if not, what can we learn from other states to possibly take that one little next step up? because those little next steps build ultimately to big outcomes.
Okay, Chris, what do you think on this? Is
Yeah,
helpful, not helpful?
No, it's helpful. And again, I think give the same advice that Sam just gave a little bit ago. Don't let perfect be the enemy of good. I think incrementally improving the report over time, and as we're able to track more and more outcomes of children and families and looking at their early childhood governance, their early childhood infrastructure, and being able to, as we get better with data over time, really continuing to do that research. Because this is where, at least our state, we're not the best at it. We don't tie things to outcomes. It's control and ideology way too often. Mm-hmm. So the more we can start aligning the outcomes with the governance, I think is great. So I think it's just continue to improve on this. And you know, for a state that moved up 12 spots but is still 27, I'm not going to lie to you. And I'm going to call you, Linda, and debate the score. So I'm going to try to figure out how to get up to the top. So anyway.
Hey, Sam, how about you?
Yeah, I mean, I think it goes back to two things, Linda, as you were saying, is that there are some, while there's no perfect model that will fit every state, there are some really key critical questions that you need to think through. And I think that this helps really elucidate those for states considering this. And I would go so far to say that, you know, even those states that moved up, this is an ongoing conversation with states. And so, you know, even I know colleagues in DC continue to have conversations around what and how and what needs to improve and how do we do this better. So I think that the value of this report is not just in the one-time, you know, release, but really in the types of conversations it can foster to try to think through the criteria that is most meaningful for your state. Again, as Chris said, that might drive the outcomes you're most targeting at your state, and really think through those questions. I will just end on the fact that I also think that part of the value of those conversations goes back to what both Chris and Todd highlighted at the beginning, is these are relationships, and no perfect structure is going to substitute the strong relationships that need to exist across you know, state leaders. And so I think that those conversations and the topics of conversations can make for meaningful progress on the governance structure, while also really thinking about building the kind of relationships you need to sustain that and stabilize it, and not just make it perfect on paper, but make it meaningful for programs and families.
You know, it's interesting because I think if you look at just what you said, Sam, in terms of a case in point, I mean, there's this isn't just a, you know, a finite goal here. I mean, it is an evolving kind of thing. And if you look at a state like New Mexico, where they were in the top and they still moved to a cabinet, and now they're looking at a real public financing model out there. But you can't get to that kind of a thing going on in the state of public financing of something when you don't have the right structure in place to do it. So I think this leads, these things lead to other things. And I think that's, the goal of what we're trying to do here. And there were states, as we know, who made significant progress. I know we're out of time, but we had one final question that popped in and people were curious. And this one really will go to Chris and Todd very quickly. Sort of now that we're emerging out of COVID and you've made progress in the structure, what are you looking at in terms of your legislatures for continued funding of some of this? And Todd, could you take that quickly?
Yeah, I'll jump on it real quick because our governor announced her budget initiatives yesterday and her budget proposal. So I'm very happy to be able to say one of the key things that we started with the great support of the governor and the legislature in the last session were state-funded salary stipends for all direct care workers in childcare. And so that began, so here's a great credit and a good example, I think. It began with our federal relief dollars. They were proven to be successful through the research and evaluation that we did. And now we as a state are continuing those state-funded stipends for all direct care workers in the state on an ongoing basis, 100% state funds. That began last year, and in the governor's budget initiative, we're proposing to increase the amount of dollars so that we can continue that on a full year basis going forward. So it's one, I think, great example of what we're focusing on is to continue to support our childcare workforce, knowing that, as some of folks in our state like to say, they are the workforce behind the workforce.
Yeah. That's great news. Fabulous, and a great segue. Chris, how about you?
Yeah, so speak about context. In our state, that we did float that idea. That idea is a non-starter, but I totally understand it. But where they do want to, what we are doing is, instead of at 75% of market rate for CCAP, we're going to 100% for 0 to 3. We're already at 85% of SMI. We're doing a lot with CTE to build the workforce through scholarship and stipends to continue education for childcare workers. We are doing what's called the ND3 program. It's poorly marketed, but for those outside of 85% SMI, if an employer wants to subsidize $200 a month for childcare, the state will then match that $200, and the family is responsible for the rest. And then looking at shared services grants with different organizations to really support the home and group childcare centers, as well as the large centers, but really starting to provide them some business support, because at the end of the day, you can't have an industry that's built on love with no business experience. I mean, we've got to support. They've got great whys, they've got great North Stars, but they don't have the background to do this. So how do we support them from that business angle?
That's a real conversation. That's for another time. So I want to wrap it up here and say thank you to all of you for a great conversation. Hopefully we'll see more change and more progress over the next couple of years. And kudos to you guys and to the states that participate in this. I just want to close by thanking all of the people around this country who helped us with this report, because we leaned heavily on a lot of people to verify our information. And hopefully it will be useful to people as we emerge out of COVID and try to make progress based on the lessons that we've learned from all of this. So again, thank you everyone for joining us today, and thank you to our panel. Great conversation, just really great conversation. Thank you. Thank you. So we're done.